Very. Now, the webinar series, this 3-part webinar series, is brought to you by the Incarcerated Survivor Advocacy Program, also known as ISAP. And we are a special program here at TAASA that offers support, advocacy, and resources to incarcerated survivors. But we also provide training and technical assistance to rape crisis centers, to correctional staff, advocates, and the general public on the work that we do. We're rooted in the belief that no one deserves to be raped regardless of what choices they've made in their lives. So if they're incarcerated and spending time in a correctional facility for a crime they committed, that doesn't mean they deserve to be harmed in any way. And you know, we really believe that all survivors of sexual assault deserve the same level of respect, compassion, and services as survivors in the community, even if they're behind bars. And so the goal of these webinars is to provide advocates in the field, correctional staff who work on PREA related issues at their correctional facility, and others with the information they need to either begin serving incarcerated survivors or bolster efforts to provide services that are already in progress. And so we're here as a resource to y'all. So again, today is the final part 3 in part 3 of 3, and we're going to focus on, we've already gone through part 1, which was on a couple of weeks ago, where we looked at the dynamics of sexual abuse and confinement. We really, drilled down into what contributes to sexual violence in correctional settings. We looked at populations that are especially vulnerable to sexual violence while incarcerated, and we laid a foundation for the correctional what does the correctional landscape look like? Like how many people are affected by this?
I did something bad.
Okay, hang on one second, y'all.
You can escape, and we need to go to the thing there, and you need to go to screen sharing, which would be, go to the dashboard, please.
What's the dashboard?
Right here.
Oh, sorry.
That's all right. I'm sorry, everyone. My bad. Can you see the screen now?
All right, sorry, y'all. We wanted to make sure you could see my screen so you could actually view the content I'm talking about. So if you are able to see my screen, please go ahead and chat in the chat box to let Wendy know, and then we'll go ahead and continue from there.
I'm so sorry.
No problem. All right, great, Maggie. Thank you for letting us know. So you didn't miss anything, guys. I was just kind of going over what the previous webinar presentations were about, and if you weren't able to attend the earlier webinars, part 1 and 2, we can certainly send you the PowerPoints, and it will also has been recorded and will be available on our YouTube channel. So fear not, those will be available to you all in the coming days. So part 2 of the webinar series, we really drilled down into the PREA standards that are most relevant to advocates. We reviewed those standards sort of step by step, and examined what the intent was with those PREA standards, and how advocates and correctional facilities can implement those standards in their facilities to protect incarcerated individuals from sexual violence. And today, in part 3, in the final part of the series, we will look at promising practices on working with correction staff, tips on how to approach a correctional agency in your area so that you can, learn more about what they're doing in their facilities, and how you as a community organization can help them and build a relationship and partnership with them in order to provide services to incarcerated survivors. And, I've been, this is one of the most common areas that I have get questions from advocates in. How do you start? How do you reach out to corrections professionals in your area? What if they don't call you back? What do you, how do you enter into a memorandum of understanding or other agreements? So we're going to cover some of that today. And, again, we're only here for a short time, an hour, and I leave 30 minutes or so at the end to answer questions. But, this is something that if you are a program and you've started to reach out to facilities in your service area and haven't heard back, please give me a call and we can kind of talk over the phone or in person and troubleshoot some of the barriers. But this will focus specifically on that, and hopefully will really encourage program staff who are on the webinar today who haven't approached correctional facilities in their area to do so. And so we're really excited to build those relationships, help you build those relationships. And so with the goal, of course, of ensuring that incarcerated survivors have services they need to heal and cope from sexual trauma. Okay, so some learning objectives here. I won't read them, but you can kind of look through them, and sometimes these are helpful to see up front about what you're going to learn. But I do want to give, many of you have worked with correctional facilities in the past, whether it's at a local county jail or a state facility or a federal facility, but some advocates doing this work haven't. And so I think it would be helpful to set up just a brief introduction to corrections culture, so that y'all can kind of hear a little bit about what the corrections culture is like in order to prepare yourself to build these relationships moving forward. So let's get started. And again, if you have questions as we go, I, of course, encourage questions. I think it's really important to the learning process. That's how we all learn. And so Wendy will be monitoring the chat box for questions, and we'll go over them together at the end. Okay, so correction structure. What is the structure of a correctional facility, and how does it differ from maybe the structure that you are used to in a local program or at a SANE program or other kind of victim-centered advocacy program? Well, correction structure places a huge emphasis on chain of command, right? That's really an important part of the correctional structure at each of the correctional facilities. Corrections facilities are often rule-based, right? There's very clear rules about what's allowed, what isn't, and then there's regimented schedules for not only custodial officers or correctional officers, but for inmates and other staff at the facilities. And that's, important because, they've got various job duties to ensure that each inmate is accounted for, during counts and things like that. And that, there isn't a lot of flexibility in those schedules just due to the fact of, corrections goal, of course, is to ensure safety in those facilities for everybody, not just staff and not just inmates, but volunteers, right? Local advocates who are coming to the facility to provide services. Those are all really important. And so you'll notice that, and this is true for the military and other institutions too. So knowing the chain of command for your local correctional facility, who do I contact, who's above them, what ranks are important to know, those kinds of things are all helpful going into this and building a relationship with your local facility. So you can see here kind of just some of the options or some of the examples of a basic hierarchy within the correctional model that we're talking about. So you've got administrative and leadership staff over here, and those are going to be the individuals that are, in county jails might be the sheriff, in prison facilities, state facilities might be the warden. Those are really your leadership staff. Those are the folks who are running the show. They are definitely people you want to be connected to and talk to as you're planning service delivery to correctional facilities, and really just talking about providing services. Now, remember from our last webinar, we talked about how correctional facilities need y'all, right? They need advocates to provide services. Under PREA, you're not required to provide services, but we all know that advocates are amazing and want to serve every survivor out there. And so, you know, that PREA is counted within, is included within that. And so you will want to get, you will want to be familiar with the administrative and leadership staff that is in your local facility. Now, that leadership and administration staff will oversee security captains, commanders, lieutenants, medical and mental health leadership, inmate services leadership. So those inmate services leadership will be things like volunteers who are coming into the facility to provide GED classes or life skills classes or other kinds of helpful information for incarcerated individuals, and maybe clergy, maintenance staff, food services, etc. The medical and mental health leadership will be overseeing the on-site doctors, nurses, social works, psych, and medical technicians that are at the facility. And then the security captains, commanders, and lieutenants will oversee sergeants and then corrections officers underneath them as well. Now, as I mentioned in the previous webinar, I believe it was the last one, we talked about how each facility, each correctional facility throughout the state of Texas and other places must have a PREA manager or coordinator at their facility. And this would really factor in most cases, this would be represented in this part here with the security captains, commanders, and lieutenants. It has to be a high-level employee who is tasked with being the PREA manager for the facility. So you will get an opportunity to really connect with that person and learn about their job functions and how you can best support their efforts. So here's just a basic hierarchy chart to kind of get you acquainted with some of the staff and roles of the staff within the facility. So administrative staff, we talked about this, includes agency leadership. So that could be the chief, the warden, the sheriff. It really depends on the facility that you're working with. If you've got a little county jail, let's say, that has 200 beds or fewer in your area, they may not have an individual, a staff member that is the PREA manager, right? It might just be the sheriff. Or the jail administrator, and that might be because they're a small staff and they don't have a large staff to sort of coordinate their PREA efforts. It would just fall on either the chief, the jail administrator, or the sheriff. So it could include the facility level leadership like we talked about, facility operations staff. So the jail administrator, for instance, would be a great example of that. And then the PREA coordinator or manager. They depending on the facility, they go by both names. So just anything with PREA in the name is something you want to jump on as advocates, right? That's going to be your point person at the facility. And again, structure and titles vary depending on the type of correctional facility. It'll be different depending on the size of the correctional facility. So just keep that in mind as you're identifying facilities in your service area. You may not just be able to call and say, hey, can I talk to the sheriff? I need to talk about PREA. You may have a PREA manager or PREA coordinator that you would communicate directly with about that. So corrections has a very clear role in our communities and in our society, right? Corrections staff are there to enforce rules, to maintain safety and security inside the facility. And of course, those safety and security can be breached if there's a escape or other kind of issue that comes up that can affect public safety as well. But the main role of corrections is to enforce those rules so that those facilities are safe and secure. And enforcing rules includes enforcing PREA rules, right? The purpose of PREA is to maintain safety and security, to reduce the likelihood of of individuals being sexually victimized behind bars. So a corrections role is very much embedded inside the PREA standards, and corrections staff take that very seriously. They also are there to supervise activities of prisoners, right? They are ensuring that they're doing activities that they're meant to, whether it's work or school or other kinds of activities. They're supervising those. They're responding to emergencies inside the facility, whether that's a lockdown or a riot or other kind of emergency situation. Corrections staff are meant to respond to that. Now, in most cases, a sexual assault is considered an emergency. So think about, the corrections staff that are responding to those emergencies would be considered a first responder under PREA and would have, training about PREA and how to respond in those situations. And then their role is to report and investigate any prisoner or staff misconduct, right? We've talked about this in the past webinars, that they can make reports, anonymous reports at that, to the facility around PREA complaints. So they have both the ability and obligation to do that. Well, what does an advocate's role look like? Well, the victim advocate is there to accompany survivors through the reporting investigation process, to provide emotional support, either in the moment, right, during the SANE exam or during the investigation process, but then also ongoing emotional support after a forensic exam or after an incident of sexual assault or abuse. An advocate is there to provide that emotional support and crisis intervention. They can also help with safety planning, something that's a little bit difficult to do inside of a correctional setting, right? But important nonetheless. And then the victim advocate is there to offer referrals and other resources to victims in order to help them heal and cope after a sexual assault. So let's just do a real quick, this is a helpful little tool, I think, developed by JDI, who says, okay, let's look at this. Let's as advocates, those advocates that are on the call today, let's look at the self-identification checklist. Okay, is your agency often underfunded or under-resourced? Check. Senior level employees wear multiple hats. Let me just check that one too. Secondary trauma and long hours play a role in staff turnover. Absolutely. Staff entered the helping profession of being an advocate because they care for others or they care about injustice and want to make it right. Absolutely. Staff are sometimes distrustful or cautious around law enforcement. That's certainly been my experience. And, this is a checklist that I can really identify as an advocate. I can identify with as an advocate. So let's look at another list. Oh goodness, where's my mouse? There it is. Here's a correction self-identification checklist. And so for those of you on the call who are work on the correction side of things, let's go through this list together. Agency is often underfunded or under-resourced. Absolutely, much like advocates, right? Employees wear multiple hats. Absolutely, that is very common. In fact, the PREA coordinator or PREA manager at the local correctional facility will often, that'll be like a secondary or tertiary task that they are meant to do. They're wearing multiple hats as well and doing all kinds of different things. And so PREA may not be the only job they're doing, right? And so it's important to know that as you're working with corrections staff that they are wearing multiple hats too, and that they're also experiencing secondary trauma and long hours, right? And that plays a role in staff turnover. And just for general information, the Texas Department of Criminal Justice has one of the largest staff shortages in its history right now. And I think that does have a lot to do with long hours and low pay, potentially secondary trauma or vicarious trauma that they're experiencing but not getting support around. So we see this happen in the corrections profession as well. Staff enter law enforcement or corrections because they care about community and the justice system. Absolutely. This isn't the job that's going to make you a millionaire. It's a job where committed individuals come together to ensure that our communities are safe and just, right? And correction staff may be distrustful or cautious around community-based organizations. They may not have ever worked with a community organization, such as rape crisis program advocates or others. They may be very wary of building relationships with community-based organizations, right? So it's just something to be aware of as you approach these facilities in your service area. And again, if you aren't sure what correctional facilities are in your service area, you can email me anytime and I will send you a list that includes the name, the location of the facility, the name of the PREA manager at that facility, and the contact information for them. So that's a resource I'm here to provide for you all. If you'll just send me an email, egamel@taasa.org, I'll get it out to you. But just know that, while advocates may be distrustful or cautious around law enforcement or corrections, the same is true for staff, correctional staff. They may be distrustful or cautious around community-based organizations, right? And how do we quell that distrust or caution? We build relationships. We're not as different as we think we are. And so as you can see here, we're really looking at core values of both advocates' values and corrections values, and there are shared values within that. So if we're looking at the advocates' values, we believe that survivors deserve support, good health, right, safety. We want to improve public safety by challenging and changing rape culture, and that we believe that survivors are the experts in their own healing. Corrections values include improving public safety and through rehabilitation, right? Through rehabilitative efforts at the local facilities and other places. They also value care, custody, and control, right? Those are the things that are going to lead to safer facilities, which is ultimately their goal. And properly implementing PREA standards into practice leads to safer communities. Safer facilities and safer communities. So we do have some shared values as well. So one is that perpetrators should be held accountable for what they do. Absolutely, that's a shared value from both an advocate and a corrections employee standpoint. Of a shared value and a belief that no one deserves to be raped, right? And that prisoners are community members who are ultimately going to return to communities. Over 95% of individuals who are incarcerated in a state facility here in Texas return to Texas communities. And so we as advocates and corrections staff, we want to ensure that individuals who experience sexual violence while in a correctional setting get the help that they need to heal, so that they're not coming back to our communities and harming either themselves or others, right? It's a really important part of our core values. So we can agree on that, I would think. Okay, so let's see here. I'm going to just fill all these in. Okay, nope, too far. Okay, so there are some misperceptions about what rape crisis centers can do or not do, depending on, as it relates to PREA specifically. But one of the misperceptions is rape crisis centers must report abuse to corrections, regardless of the survivor's wishes. That is not true. The clarification obviously very clearly states that rape crisis centers must comply with the state mandates on confidentiality, and that you will follow and comply with your own state mandates and your own internal program policies with regard to confidentiality, and that there isn't an automatic must that you report any allegations that you receive from survivors to the corrections department. Another misperception is that rape crisis center staff inhibit good investigations. That's in the clarification, it's actually just quite the opposite. Rape crisis center staff support good investigations, right? They support the survivor through that investigation interview, through the scene exam. This is all going to result in a better investigation process where the survivor feels supported and is able to share information with investigators to ensure that the alleged perpetrator is held accountable for what happened. So really, rape crisis center staff contribute to good investigations. We don't inhibit it, we help. That's what we're here for. And the PREA standards are binding on rape crisis centers. We've talked about this in the previous webinars, but the PREA standards are not binding on rape crisis centers, but they are on corrections agencies and facilities. So again, those correctional agencies need you, community advocates, at local programs to provide services to incarcerated survivors. So how do we build successful partnerships with correctional staff, right? Like there's got to be a solution, and there is. First of all, if you haven't reached out already to your local facility, you'll want to do that. You'll want to introduce your agency's role in the community and the services you provide. And again, this isn't just to provide services to incarcerated survivors, but you're part of the community that this correctional facility is in, and your services are available to staff members there as well, right? And I think that's a really important piece to convey when you're in this initial meeting with your local correctional facility, to indicate to them that you are the program in their area that helps all survivors of sexual abuse, whether it was during childhood or in the past, or if you're actively experiencing it, that you are the agency to help support individuals in that. And I think that's a really good way to sort of introduce your services. And then you could say, and we also could provide services to incarcerated survivors in your facility as required by PREA. But that you're really there in the community to provide help to anybody that needs it. So at that point, you could discuss and this could be by phone or in person, depending on your ability to get a meeting with the individual at the correctional facility that would be most relevant to this purpose. But you'll want to discuss your interest in providing services to incarcerated survivors. You could talk about how long you've been around, maybe some previous work you've done serving incarcerated survivors or other survivors in other institutions like military or on college campuses, etc. You'll want to establish a shared goal of eliminating sexual abuse, right? Just come out and say it, like, we're here to help you eliminate sexual abuse in your facilities, and we are happy to do that. Discuss the role of an advocate. They may have never worked with advocates before. Advocate can be one of those nebulous words where it's like, well, what exactly are you? Are you an attorney? Are you, do you work for local law enforcement? Whatever. You'll want to be very clear about what the role of an advocate as defined by your program is, and then learn about the role of a corrections official in working with survivors of sexual abuse. What kind of things do they do on their end when someone comes forward with allegations of sexual abuse? And then, of course, you'll want to discuss your role and what you guys do when you hear allegations of sexual abuse, either in the community or in a detention setting. So really that initial meeting is something you could even do by phone if you wanted to. I find it sometimes difficult to get people in person just because it's hard to leave the facility grounds or the campus grounds to meet outside of the facility, right? Like their corrections professionals are really meant to be there and ensuring safety and security at all times. So if you can't seem to find a place to meet, then a phone call, I think, would be your next best bet. So during this initial meeting, you'll want to ask questions. Ask questions about the facility's basic protocol in responding to reports of sexual abuse. Of course, you don't have to use that language, right? You could just say, hey, I'm really interested in learning about what's your, how do you follow up and how do you respond to individuals who report sexual abuse? What's your process look like? And they'll take you through it. They may have policies on paper as well that they can show you, so you get a better understanding about how reports of sexual abuse are handled within the facility. This will also help your advocacy efforts tremendously to know how a facility responds to these reports of sexual abuse. And also, when does an advocate come in, right? When would the advocate be asked to come in during, is that addressed in the basic protocol, in the facility's basic protocol as well? Does it say anything about contacting advocates from the local program to provide services, et cetera? Now, if it doesn't, you want to discuss what services may look like within the facility. And you can just say, like, have you guys ever provided services to incarcerated survivors before? They may want to know, the corrections facility staff may want to know, have you ever worked with incarcerated people before? Is this a new population you've never worked with before? That's really important, so you guys can kind of learn from each other about what services might actually look like within the facility. And then as part of that, discuss those anticipated concerns and challenges on both sides. And there will be concerns and challenges. Can they be overcome? Absolutely. That's why having this initial meeting and these ongoing discussions about what services might look like, and looking at those concerns and challenges and barriers ahead of time can really be helpful. And then, at the end of the meeting, you'll really want to create a plan for next steps. So if they feel, let's say you are working with a PREA manager at a local county jail, and they are so excited about partnering with you to provide emotional support services for any survivor in their facility, you'll want to create a plan for next steps, right? Like, well, what would come next? Can we have a follow-up phone call? Could we meet for lunch and talk about what an agreement might look like? Can we start small and build out, down the road, that kind of thing. So you'll always, during this meeting time, and this is always, something you'll want to keep in mind always, but you really want to frame your services as an asset, which they are. Your services are not only so necessary from a survivor standpoint, from an incarcerated survivor standpoint specifically, but again, the correctional facility really needs you as a service provider under the PREA standards to provide services to their population. So you're really you don't really need to sell yourself too hard, but you do want to remind them that your services are an asset to that facility. And again, rely on those PREA standards as a tool, and you can mention specific standards if you find that helpful. That would be under standard 115.53 for the adults in jail and prisons. But you'll want to know some of the standards as it relates to your service provision inside the facility. And again, remember the agency needs you to properly implement the PREA standards. So you guys are here to help, and that's exactly what advocates do, right? So you could frame your services in a way, to say, like, look, we're a resource to you, and generally speaking, a free resource, right? Your services, partnering with the local rape crisis center, will provide more resources to the correctional facility in order to end sexual violence in facilities. It will provide better investigation outcomes, improved response to incarcerated survivors, right? Safer facilities, that's a huge one. The ability to participate in a local SART. I think that's another important piece that is sometimes forgotten, is that correctional facilities in our communities are part of our communities and should be part of our sexual assault response team. So inviting them to a SART meeting, or encouraging them to find somebody to send to a SART meeting so that they can be part of that team, because they're part of the community. And then your services will also assist with PREA compliance. So what I like to do after having a phone call meeting or an in-person meeting, and describing all these great benefits of working with local programs, is to send an email confirming what you guys discussed at the meeting, and send the email to everybody you met with, thank them for the meeting, and then confirm what you guys discussed. You may at that point have an opportunity to draft or review a memorandum of understanding if you're interested in entering into an agreement with a local facility. Now, they may have a template that they use for the MOU or MOA, or you may have a sample MOU or MOA. And so you'll want to know, you'll want to obviously review it. And, if you have any questions about that, you can always contact me as well. I'm happy to help, look at the language and make sure, it's going to work, and for what PREA requires, and for what y'all are able to do. in some cases, I've heard of advocates just getting an MOU by email and saying, hey, could you please sign this so that we can be PREA compliant, and it may be very confusing. So please don't hesitate to reach out to me and we can talk over these kinds of things. But ideally, the goal with this is to enter into an agreement with the local facility to provide services. Again, invite the corrections department to join the community SART, and then continue with your next steps that you've discussed and check in with each other. Now, I'm not trying to be disparaging to corrections professionals, but they have a lot of work, much like advocates. They wear many hats. They're doing lots of different things. You may not hear back after reaching out to them 3, 4, 5 times. So really, my suggestion is to be persistent. Of course, that's true in so many ways, but I find it to be especially effective when building relationships with corrections staff. Be persistent, be positive, but always be persistent, and ensure, in trying to get them to meet with you and talk about all the wonderful resources that you can bring to their facility. Identify and pivot back to those common ground and shared goals of safety, security, ending sexual violence in facilities. Those are all common ground and shared goals that you guys can bring up again and again when you're building this relationship. Pivot back to those shared goals and common grounds, right? And the goal, of course, is to build trust with this person and establish a relationship that you can rely on. You also want to be upfront and firm about your limitations. If you find a facility who is so gung-ho about you providing services, they want you to come and do a weekly group, right? Every week they've got a group of 50 people who want to attend. Well, that may not be you may not be, as a local rape crisis center advocate program, you may not be able to provide that kind of level of services, but be very clear about what you are able to provide. So maybe it's just the the forensic exam accompaniment. Maybe that's all you can do. That's okay. Just be very clear in the beginning as you're building relationships with the facility about what your limitations are. And you also want to be clear about, at this point, about any payment for services or other kind of compensation that you require as a part of the MOU. And a lot of that will be outlined in any agreement you come to, but you may want to give them a heads up, like if you know you can't provide services unless there's a fee for service established, then be very clear about that, right, with them ahead of time. Because, as you might expect and probably already know, many correctional facilities, whether it's a state or county operated facility, are, not fully funded and may not have the money to put towards providing services, and they may be under the assumption that you'll be providing those services for free, which, if you are able to do so, I highly encourage. However, if you aren't, be very clear and upfront about those limitations in the beginning of your as you initiate these meetings. So this, I think the goal here is to have a written agreement between your local program and the correctional facility that you're providing services to. So a written agreement can look like a variety of different things. It could be a memorandum of understanding, but really essentially what it does is outline the commitments of each party. What does each party say they're going to do? You'll want to include, you'll definitely want to know what's required in the PREA standards so that you can include language that's responsive to the PREA standards in your agreement. And so that might be things like describing limitations to confidentiality. It may be describing the investigation process and what role the advocate would play in that kind of thing. You'll definitely want to include any deal breakers in there. Getting that stuff down on paper is really important. Allow for flexibility. These agreements can change over time, so you will want to allow for flexibility in the agreement language. And again, another recommendation I have is to include language in the agreement that says you'll reevaluate the agreement in you know, a year or two or whatever time frame you guys want to do. That's important because let's say you get an MOU going with a local county jail and you're all excited because you're going to provide services to a really underserved, disenfranchised, vulnerable community, and then you never hear from them. Like you just never hear from anyone, whether it's a survivor or a staff member at the local county jail. Well, you want to, in your agreement, you want to have language in there that allows you to check in with the facility to see what's going on. Is there something in the agreement, or is there something we could do better to ensure that survivors have the information they need to reach out for resources and support? So just including some language in your agreement that says we'll check in biannually about how the agreement is going or whatever, I think is a really important piece of this. Okay, so let's talk about strategies for addressing common concerns that can come up as you build these relationships with correctional facilities, right? Well, you really want to take advocate safety very seriously. And of course, we take safety very seriously at TAASA, and advocate safety especially very safe, and survivor safety, right? Very seriously. But these are some questions you'll want to ask yourselves, your staff, your board, your volunteers. These are things that will come up in service provision to incarcerated survivors, and so you want to be aware of them before and know how to respond to them. So for instance, you know, safety is a big concern. What if the survivor is in prison for sexual assault? What if the reason they're incarcerated is because they were sexually violent with someone? Like, how does, you know, that can cause some cognitive dissonance and some other apprehensions about providing services to this individual. But these are the kinds of questions you'll want to talk about internally as a staff. What do you do if the survivor threatens the advocate or makes them feel uncomfortable? That also should be addressed with your staff or volunteers, but also mentioned or discussed in the MOU. You know, so there may be things that the correction facility can do if a survivor threatens an advocate, right? There might be some disciplinary measures that are taking place or other kinds of measures. In general, though, this will be very similar to what advocates do if a survivor in the community threatens them or makes them feel uncomfortable, right? Like it would be, and whether it's ending the session or, you know, whatever it is. But generally speaking, that those things can be very similar to what you're doing already in the community. Another safety concern, what if there's an incident while an advocate is on site providing services? Is that a possibility? Absolutely. Lockdowns happen, incidents happen. There could be a disruption of service. You may not know why or where. You might just hear a loud noise and people running, whatever it is. This piece is really one you're going to want to talk to your corrections facility staff about. What do you do as an advocate if you're on site and an incident takes place? And they'll walk you through it. Generally speaking, you'll get a tour of the facility before you provide services. You'll talk to the key staff who are there to ensure your safety. You'll get information about what to do if there's an incident, etc. But it is important just to give folks a heads up that these things can happen, so be prepared. What happens if a corrections staff member is unprofessional towards an advocate? It's possible that would happen, and it may be something that you guys talk about as a staff or as an agency. You know, what do you do when other staff, when other agency staff that you interact with are unprofessional towards you? The key here is to say, like, you know, if you feel like there's some unprofessional behavior from correction staff or whomever, that this kind of thing can be addressed through your partnership or agreement, and you'd be talking with the PREA coordinator or the PREA manager or the point person at the facility about that behavior, and you guys can kind of talk about you know, what happened and what needs to happen next. But know that that's a possibility as well, for the reasons we talked about earlier about that distrust piece. So again, you'll wanna be aware of that before providing services in these settings. So you want to be sure to use your resources, and one of the best resources you can use besides the PREA standards, which again, the webinar that we did the deep dive on the PREA standards last week will be available on our YouTube channel. So if you've missed it and would like to refresh your knowledge of those PREA standards, it'll be available soon. So you'll want to use your standards. You'll also want to use an MOU or other agreement to provide guidance during any difficulties you encounter, right? That language in there is going to be so helpful as you navigate this relationship with the correctional facility staff and as you provide services to incarcerated survivors. You can go back to your MOU or other agreement and say, oh, actually right here it says I can do X, Y, and Z. You can also, if you encounter issues that aren't addressed in your MOU, take note of those, and then when you're update your MOU or other agreement to include those issues or solutions you found to issues that you encountered earlier. So that's a document that can be can be changed, can be added to, can be revised, etc. Really use that MOU to your advantage. You also want to contact your point of contact at the facility, typically your PREA manager or your PREA coordinator, to work out any issues that arise. So if you felt that a staff member was being rude or unprofessional towards you or a survivor, you may, and you aren't able to resolve it with that person at the time it happens, you may want to contact the PREA manager to work out any, to give them information about what happened and sort of, what you would suggest changing or whatever. You also will want to know, like, ahead of time, what I would recommend is, as you are establishing relationships with that PREA manager or coordinator in the beginning at the initial meeting, you could talk to them about, hey, what happens if I show up at the hospital and to see a survivor for a forensic exam, but your facility staff won't let me access them? Like, what is the protocol for that? Can I call you? Can I call somebody else? Who's the best person to talk to about this, et cetera, et cetera. So all of that you'll want to work out ahead of time. And again, you're going to want to contact the PREA manager at the facility, and this will be your point of contact kind of going forward. And then again, contact the agency PREA coordinator if the issue persists. Not every agent, so we talked about this in the first webinar, but the agency PREA coordinator is only appropriate for some correctional agencies, like the Texas Department of Criminal Justice, like the Texas Juvenile Justice Department. Local county jails are less centralized, and so you'll have to identify the person at that facility that works on PREA issues to work out any issues. But again, I have that list. I have the list of all the facilities in your area. If you're interested in knowing that, please just email me. All right, we're gonna skip this because I want to make sure everyone has a chance to look through some of the materials that we have. So TAASA obviously is here to support you in any way we can, and we do a variety of things under the ISAP program that helps support advocates and others who want to support incarcerated survivors. So we provide materials, which I'm going to take you to our website in just a second to show you where some of those are living. Training and technical assistance. I'm happy to come out to your site and train your staff or provide on-site technical assistance around establishing these relationships. I'm happy to help facilitate MOUs and other agreements, looking over language and that kind of thing. We provide resources, whether it's material resources or otherwise, webinars, sample documentation. I do have a sample MOU template that I'm happy to send out to anyone that's kind of curious about what a good MOU looks like. TAASA is also here to be a liaison between your center and a correctional facility. That's something that's very important. we have the capacity to sort of facilitate those relationships, even if you don't, and we're happy to do so if that's something that you're interested in doing. But let's just take 1 minute to identify other things that might be helpful to you all that are on this webinar right now. There's 41 of you, so I really do expect some great answers. But I do, it's so helpful for us to hear from y'all about what the need is. Is there something that we could do to ensure, to help better support you in providing services to incarcerated survivors? So just take a couple of minutes to chat into the chat box and we'll review them in just a second.
Okay. Yes, we're still here. Did y'all experience a audio glitch?
Okay, great. So, as you start to think about what other resources would be helpful for you, and you may not know right now, I completely understand, but just keep that in the back of your mind as you, put what you've learned in these webinars to use, and just remember that we are here as a resource for you. Okay, so I do want to take a quick minute to, if I can figure out how, to show you our website. I wanted to give you some information about where to find resources on our website. So here I am at the TAASA website. Not sure why it's not secured, but anyway, TAASA.org about PREA/PREA. This will take you to our page where we talk about the ISAP program. PREA information, very generally, is covered here. PREA in Texas, just looking at how PREA compliance in Texas is, and then also the rates of sexual abuse in Texas as well is highlighted here. So just to give you an example of sort of the background of some background information that might be helpful. And then if you scroll all the way down under helpful resources, if you haven't had a chance to go through these, please, I encourage you to. These are all here for you to download, to order for free, and can help you, I hope, in providing services or starting to provide services to incarcerated survivors. So the first thing is a report here. I'm not going to open it just because it's a research report that you might If you want to get a background on the rates of sexual abuse in Texas prisons, you can read this research report I wrote. The Coping Inside program info, I'm going to go ahead and click on this. I think this is a really important program that we've developed at TAASA. And the Coping Inside program is a self-led therapeutic program for incarcerated survivors of sexual assault. And this is an information sheet about it. But essentially, we created this in tandem with the UT School of Social Work as a sort of a stopgap for incarcerated survivors who do not have access to traditional support services and coping services, right? This is a population that is probably has the least access to traditional support systems. And so since there are so few sexual assault programs that have partnered with facilities to provide services, we created this program as sort of a stopgap until every facility has all the resources they need. But it's really meant as a self-directed correspondence program. It's free of charge to all survivors. It provides therapeutic resources and educational materials to incarcerated survivors or others. And here's the outline of it. It's 12 months, so each month a new module is mailed out to the individual, and they can go through it at their pace. And at the end of the program, so after a year, they receive a certificate of completion. In my case, in my experience, individuals who take part of the Coping Inside program we get the best feedback from individuals who have gone through the program. And in fact, they share it with their friends and other people who are incarcerated who maybe don't have access to information about anxiety and depression or how to cope with PTSD and other things. So this is available to anybody that would like it. I have the 12 individual modules available to email to you if you would like them. And then you can print them off as needed, but please let me know. You can email me. I just wanted to let folks know this is available and encourage y'all to, encourage y'all to use it as much as you'd like. So that's one. And that's right here. And again, if you want the 12 modules, you're gonna have to email me. I know it's so much work, but it helps me to know where the Coping Inside program is being used so that I can provide ongoing support to individuals there. So that's available. If you're interested, this is a lovely little resource that I'm thrilled with. We talked about learning the investigation process. Here is a flow chart that describes a sexual assault investigation inside of a Texas Department of Criminal Justice facility. There's 109 facilities throughout the state. So this is how that agency investigates allegations of sexual assault. So this may be a helpful resource for those of you who are providing services to TDCJ facilities. That's available on our website. We have this PREA brochure, which is available for ordering for free. You can on the previous page, there's information about how to order it, and it goes over specifically TDCJ staff responsibilities, but I do think that this could be used for county facilities and other correctional facilities where you might have survivors, right? And so we'll work. I think one of the goals of the program is to excuse me, is to update this so that it can be used for different populations, whether it's a county jail or a juvenile justice facility or an immigration detention facility. But this is available. We have them printed. Again, you can order them online for free. So it gives you some information that you can send to individuals who contact you about PREA and information about how to report, etc. Okay, so here's where you would order it, right? You would go to our store where we have a bunch of wonderful materials that are available for free. A new toolkit for y'all, if you, it's called Words of Hope, starting a correspondence program, advocacy program for incarcerated survivors. And this is a toolkit intended for individuals who, or for programs who are maybe just starting to provide services or interested in providing services but don't know where to start. A correspondence advocacy program is one of the most effective and inexpensive ways to provide support to incarcerated survivors. So I really encourage programs who aren't really sure about what they want to do to start a correspondence program. And this toolkit will walk you through it, okay? It'll explain about all kinds of helpful information on how to do that. So that's available for you all as well. There is a resource sheet for individuals who are incarcerated in Texas and have identified as survivors that provides resources to agencies and organizations that are sort of outside of your focus area. So let's say you're assisting somebody who's an incarcerated survivor and they ask for legal resources to help them. Well, you may not be able to provide legal advocacy or representation for them, but you can give them this sheet, and under the legal side, it'll list out organizations that may be able to help them. So this is something you can print out and mail to individuals who request it, or provide to family members of incarcerated survivors or whomever. But that's available on our website as well. See, I bet y'all didn't even know that this was here, right? And then obviously, if you want to do a deep dive into the national PREA standards, I have a link here to that. You can also just Google PREA standards, you'll find them. And then one of our earliest webinars is here as well, serving incarcerated survivors. Many of you have already probably seen that or a little bit beyond it, but our webinars are also archived on our YouTube channel. So you can also view and review past webinars on there. So that's our helpful resources. Now I'm hoping some folks have some questions. And I'm happy to answer some questions from, it looks like we didn't get any.
We didn't get any.
We didn't get any, this is great. Clear cut, oh, I love it. Let me, would you guys just indulge me just once, if y'all let everyone go early so you guys can actually eat some lunch, but how many folks on the call are from a program in Texas? If you are, just say me, just type me into the chat box. I just want to kind of get a sense of how many advocates we have in the, and again, in Texas specifically. Hey, Stephanie. Yay, Beth, at Safe Alliance. Hannah at the Sheriff's Office, awesome. Margie, cool, this is great. This is just helpful for me to sort of, envision who's using this training and how helpful it could be. Brenda, hi. Brenda, I know she's, Brenda Hall works at the Texas Department of Criminal Justice and is instrumental in ensuring that PREA standards are implemented there. So thank you so much for being here. I really hope this was helpful to you. This webinar was meant specifically to put tools in your hands to begin serving incarcerated survivors in Texas. And so I hope it was helpful in that way. And again, we're here for you all. So if there's something that you need, please reach out and let us know. And we are happy to, or at least I am happy to, develop specific trainings that you may need, or specific materials that are responsive to your needs. So don't forget that we're here. And if you need anything at all that we can help with, we'll try to do it. So I just want to thank everybody again for attending the webinars, especially those programs that attended all three. If someone from your program attended all three of the webinars, I'll be sending out a little special certificate with some additional thank you materials in there. So keep an eye out for that. Anything else you want to add, Wendy?
Not much.
Great. Well, look at me. I whizzed through. All right. Great. So I'll follow up with those individuals from programs that attended all three webinars. If you weren't able to attend all three, that's no problem. They will be archived on our YouTube channel and it'll be available there. So thank you all again so very much.
Okay, just remember in closing that in about an hour, you'll receive a follow-up email with a post-test, an evaluation, the webinar, and a link to your certificate of attendance. Thank you so much for everything that y'all do. We'll be here for a few minutes. We're going to mute ourselves, but if any last minute issues come up, please don't hesitate to chat them in. Thanks.